ACA has put in motion forces that will cause, in our estimate, between 20 and 40 California community hospitals to close by 2020. There are 400 community hospitals in California. Half of those lose money on operations. They do not have the financial backing of a larger multi-hospital organization.
St. Rose and other community hospitals are having difficulty meeting the basic needs of staying in business. We need reimbursement just to meet the basic costs, our fixed costs within the hospital. Right now, the reimbursement structure within Medicare and within the Medi-Cal program are structured that it does not even meet those basic costs. So St. Rose Hospital is at risk of not surviving going forward.
Under the ACA and the amendments to it, hospitals nationwide between 2010 and 2020 will have their payments cut by $175 billion. We are going to price the private insurance market totally out of business. Right now, today, you and I, in our private insurance premium, pay 40% more than the cost. And that 40% cost shift is to cover these losses into Medicare, Medi-Cal, and the uninsured. Pretty soon, the employers are going to say, am I willing to pay 50% more just to be in the private sector? And in January 1, 2017, the ACA authorizes everybody to go into the exchange.
If a community hospital like St. Rose didn't exist, it would mean that I would have to go back to a hospital that I came from, a county hospital, where there's too many patients to doctor ratio. They just don't care as much. They're too busy, you know.
The patients will have to travel many more miles to seek the same care that they're currently getting at St. Rose. In addition to that, there's an impact to the community. St. Rose employs over 800 people right now. And so if St. Rose ceases to exist, it's a big impact to this community because those people are then going to have to go out and find other jobs. And as you know, finding jobs in today's economy is very, very difficult.
I was a patient here. I not only work in Hayward, but I also live in Hayward. I feel as an employee, I benefited from coming to St. Rose here in my town. I didn't have to travel far. I was able to leave work and come straight here.
We can't afford to lose community hospitals. When you need health care, 5 or 10 or 15 minutes is the difference between life and death. And in health care and with hospitals, we are talking about life and death decisions 24 hours a day. And so as a consumer, I have to have a community hospital with an emergency department located close enough that I can get there when I have an emergency. I depend on it. My life depends on it. And that's the importance of a community hospital.